Welcome to everyone. Emiliano, me and Dr. Ferrari, we will try to share with you which is the feature of this product. It is based again over our main product, which is the OT Equator abutment. You can see here in the drawing. The OT Equator is our abutment that is born to be used with a removable, but it's what we can say an universal platform that can be used for multiple functionality, overdenture, removable bar, and fixed solution, screw retain, or with the easy fix as snap-on. Please, Emiliano, this is the design. This Equator is available for all the implant brand in the market for any platform and any height. So who is interested to use is enough to share with us which implant is using, diameter, cuff height, and it's we are pleased to prepare the abutment to support you. So till now, the Equator, you can see that we have split in 3 different functionality. Number 1, overdenture with the plastic retention, so the classic functionality. On number 2, is used to retain a CAD-CAM bar or cast bar. Number 3 is used with our OT bridge that is born to be a screw retain with saving 25% of the screw channel. So this is a brief picture of the main use, which is an overdenture, single retention, different color, different retention. So this is standard. We are all in the biggest implant company catalog, or everything is available from us, so from our dealer and distributor all over the world. The same, you can see the Equator have one internal thread that can be used like an MUA, a standard MUA, not in this case as an overdenture with the plastic retention, but to retain a CAD-CAM or cast bar with the Equator on top. So the design of the attachment is the same. So we offer another prosthetic solution together with the number 3, which is the OT bridge, and that is using the Equator as an MUA again, the internal thread with the white plastic secondary retention, tie base, so screw retain, saving some screw channel. This is our existing portfolio. And now, which is the next frontier, how it's writing in the slides, there is a new solution that I think it will be an innovation in the dental market, because we designed one new solution using the tie base over the Equator with a snap-on functionality. Why? Which advantage we have using this solution? First of all, we have the absence of prosthetic screw, and that is the biggest innovation comparing to the other solution. Remember, is a fixed, not a removable solution. Then the hygiene, it's guaranteed because the sealing of the tie base is absolutely same as a tie base screw retain. We have different color for different retention level, depends the implant, the number of the implant, the divergence. We have also one solution to remove easily because it's a snap-on, but it's very tight to remove. For that reason, we have one tool to remove atraumatically. The tie base, thanks to the extra grade design, correct till 60-degree divergence. And what is another big advantage is without any screw, the removal from the dentist, it will be super fast, and this will decrease the time of the hygiene, annual hygiene periodical, meeting that made from the patient. Now, you see that we have different color, different retention of the seeger. Is a seeger different from the OT bridge, is made by PIC, is a, everyone, we know that is a very strong material. We have different retention because we may have different direction, we may have different number of implants. Remember that always is a full arch solution. So we have the tool to insert this, the seeger in the tie base, and we have the other side of the green tool that is made to test before snap in the mouth of the patient, checking that the seeger is placed correctly in the tie base. You see that we have one hole, that is the hole for the removal of the bridge from the doctor during the periodical control and hygiene of the bridge. What we can do, the dentist, and Dr. Ferrari will explain you better later, we can choose together with the doctor which is the best position for the hole to remove the bridge in the mouth. So how? You can see option A, B, C, D. This is an example of 4 implants in a full arch. We will choose the hole that doesn't give any aesthetical issue for the aesthetic, and we choose the best position also to be affordable for the dentist to be used in an easy way. So if the anterior hole doesn't give an aesthetical problem because it's lingual to the anterior teeth, we will choose the anterior hole, of course. Otherwise, a posterior one to remove the bridge. How it works? We have a tool that is, we have to insert, we have to screw, and by screwing, the tool will push out the bridge from the position. You can see a video that is more easy to understand. The tool is rotating, and you see by the rotation, the tool will push out the tie base from the original position in an atraumatical way. So the doctor and the dentist, using the control and the hygiene, can remove the bridge easy. Then you see we have in this prosthetical project, they choose one anterior hole because it's lingual to the anterior teeth, and one posterior hole because in the anterior area the hole was giving some issue for the aesthetic. Now we have the hole to remove. Why why not to use a locking screw first to fill the hole and to have one extra retention, because we must create one hole to remove. So just we have the hole, we use one screw also to lock in the bridge. How I told you before, the hygiene is guaranteed. You see the sealing of the tie base, it's perfect and same as a screw retain. We have also a sealing screw. So on the other equator where any screw are going into the thread, the dentist can seal the square hole by a sealing screw to be more hygiene, to leave less hole that can accept saliva or dirty fluid. Okay, so that is to improve the hygiene of the prosthetical project. The design of the grade allows the system to correct till 60 degrees. And now you see this is the base feature of the system. We will go now, thanks to Dr. Ferrari, more clinically into a prosthetical case plan, because we did many prosthetical case plan within 2 years of experience. Everyone were successful, and we would like to share with you clinically, thanks to Dr. Ferrari, his experience on the solution. Please, Ferrari, you can go ahead.
So, good afternoon to everybody. I will share to you a clinical vision of this new product. And first of all, a little introduction about the importance of the connection between implant and abutment, but of course, between abutment and crown. We've got a different way to get the union between abutment and crown, so cemented rehabilitation, screwed rehabilitation, conometry, or easy fix. All those kind of way to work have benefit and disadvantages. So when we work in a cemented way, of course, the benefit are related with the integrity of the occlusal contact. We have more aesthetic, we have passivity, and we can correct this parallelism. But of course, we have the disadvantages related with the cement. So the removing of cement and the difficulty in inspection or in removing when we want to check something or we want to take a look to our implant platform. When we work in screwed way, we have all the benefit related with the screw. So easy way for remove, absence of cements, but of course, the disadvantages are related with the loss of occlusal integrity, because in our prosthetical project, we have to leave the space to catch our screw. So, of course, we got a problem in aesthetics and in the integrity of the occlusal surfaces. Of course, we got also long inspection time if we have to manage a big number of screws. So, the idea of the easy fix is to get together the benefit of cemented and screwed rehabilitation, because in this case, we have the same benefit, aesthetical and in the integrity related with the cemented rehabilitation. But at the same time, we have the absence of the cement and easy way of removing, so short inspection time. So we get together all the benefit of cemented and screwed rehabilitation. The way we usually work in screwed way is OT bridge. So OT bridge is the way to realize the fixed screwed rehabilitation on the head of the equator using the equator at the same way we use the multi-unit abutment with a lot of benefit. So until yesterday, that was the way we work. Now we have a new change. So not something that is a substitution of OT bridge, but new change for particular case. Because in this way, we can obtain this kind of results. So full arch rehabilitation, fixed, without screw, maintained just with the help of one screw, using the hole that is projected for the removing of the rehabilitation, as Gianni told you before. So now we have chosen 3 different clinical cases to share with you our experience, different way of working, different situations. So first of all, the remaking of a pre-existing project on OT Equator. Second one is a delayed loading case of full arch rehabilitation, and at the end, the immediate loading solution. The first case is very interesting because it's 10-15 year remaking of an old project who work on Equator, because it's a project released on a bar. In this case, the reason to get this bar at the beginning was for aesthetical reason, because of the smile of the patients. After a lot of years, we have aesthetical reason to change the rehabilitation, and we want to explore the option to go in fixed way. So first of all, we have removed the bar and taken an impression of the soft tissue and of the position of our abutment. And moving in digital way, we also take an intraoral scan to get the perfect position of our implant. Now we just have to match all the information with the information of the 3D scan of the face to create a virtual patient, to work to get a project in these virtual patients. The matching of all this information coming from analogic world and digital world was easy. And on that way, we can reproduce in the software the situation of the patients, and we can design, we can project a change of smile, taking care about the new parameter of the patient after 10 or 15 years. So if this is the scan of the whole situation, we can design a new profile of our teeth, a new shape of our teeth, changing the length in the upper jaw, and on that way, changing also the smile line that was the big problem of the whole rehabilitation. So here in digital world, we can design a new shape, a new project for our rehabilitation, and we can print to realize an aesthetic test. So first, to decide the final project, we can go directly in mouth with a printing test of our desire, of our project. At the same time, using this digital workflow, we can print a check to be sure about the precision of our intraoral scan, because you know that when we work with fixed rehabilitation on implant, of course, it's very important to check the precision of the position of our implant. So that's what we can imagine in our virtual patients. So the new profile, the new design of the teeth, starting from this situation to arriving to this one. So that's our desire. And now we want to understand if it's possible to work to catch this kind of results. And we can go in mouth with the printed aesthetic test and have good feedback about the aesthetic and about the new project. So for that reason, together with the patient, we agree about these aesthetical results, and we are pretty sure that it's possible to realize a fixed rehabilitation starting from a hold removable rehabilitation, always working on the OT Equator. That's very important things. So we don't have to change nothing about the prosthetical connection because we work on an abutment who give us the chance to move from removable to fixed rehabilitation. So very interesting situation. That's an intraoral scan of the printed aesthetic test that show you the precision of the contact. So everybody, we change the project, but all the parameters are maintained into it. So that's why we are sure we can work on that way. So now what we have done is to take an impression of the profile of the soft tissue using our printed aesthetic test. And we went in mouth to check the precision of our intraoral scan using this printed check. With the modified printed check, we can have a gypsy model on which we realized the analogical part of the project. And on this gypsy model, we can reproduce the soft tissue, so the gum, thanks to the impression of the soft tissue we have taken with our printed test. So we go in and out from the digital and analogical world to get all the information to take the best of both the kind of work. This case is maybe our favorite case because it's one of the first. It's come from 2 years ago. At this time, we don't have the mathematics. We was trying this system. So to move from the analogic world, so the gypsy model with the easy fix abutment, to the analogic world, we taken a scan of this model. And so on that way, we can move from analogical to digital world. Nowadays, we don't have to do this step because, as Gianni told you at the beginning of this lecture, all the mathematics of this new product are available to be used directly in digital world. So we move to the digital world, and on that way, we can design our first provisional and a plaster control key to be sure about the precision of our impression. We go in mouth with the plaster control key, and we have the comfort of the precision of our impression. And now we got all the information to design the project because we are sure about the position of the implant. We have an accepted from the patient project of the final volume. So we have all the information. With this information, we design, first of all, the metal parts, and after that, the aesthetical one. This is the design of the laser melting bar, and you can appreciate the precision of the connection with those new kind of abutment. Here, a view from the side on which you have to bond this new easy fix abutment inside your laser melting bar. That's the aesthetical part that will be bonded on the metal, and that's the realization of our provision. Why a provisional? Because we have got all integrated implant. A provisional because we move from a removable to a fixed rehabilitation, and the patient share with us some preoccupation about maybe the phonetic. So we want to try, first of all, for a few weeks or maybe a month, the way of speaking of our patient. So first of all, we realized a provisional. But the way the provisional work is the same of the final rehabilitation. It was one of the first case, so we was checking the correct position in which the correct position to choose for the using of the extractor key. So for that reason, on the master model, we do some check to find the function, to find how the different holes are available to use the extractor tool. This was a hold case, I repeat. For that reason, at the beginning, we get a screw for remove that must be used with the usual screwdriver of Rhein83. Nowadays, we have an unlocked instrument dedicated that is a one piece that can be used to do the same things. So in this picture, you can see a sequence of use of the unlocking screw, so two pieces, the screw and the screwdriver, but it's the same way nowadays work the unlocking instrument. So you can see that the more we screw our screw inside the hole, the more we have the detachment between the abutment and the equator. Okay, so that's the secret to remove easily and in a traumatic way this kind of device. Here we have a vision of the lower provision, of the upper provisional, and in mouth how they work on our equator. So that's the situation in mouth of our equator, and here the insertion of the Seeger. In this whole case, you will see different color of the Seeger respect the one you can find today in the catalog, because it was an experimental way to try the correct color and the correct strengthness of this Seeger, but it doesn't change nothing. So nowadays in the catalog, you can find blue or green Seeger, because new color are beige and white and red. This is the provisional in mouth, good aesthetical results as we expect from our project. And so now we are happy to go to the final rehabilitation, because we have a good provisional, we have the patient that agree with the new project, and we can move from the provisional to the final rehabilitation, just having a little change in the shape of the teeth. So here you can compare the final project with the scan of the provisional, and important things, the design of the metal structure, because the shape of the metal structure depends on the kind of the material you choose for the final rehabilitation. So in this case, we will have injected composite, and we design a metal structure with the correct thickness and the correct retention for this kind of material. The shape of the laser melting structure is the same of the provisional, so with the dedicated spade to bond our abutment. And here you can see the insertion of the Seeger. Those black ones are the lab Seeger, so the Seeger that your technician will use during the lab time, during the lab working. The insertion of the Seeger is the same you will do in mouth with the final Seeger. So there's an instrument, an inserter that easily give you the chance to put the Seeger in the correct position without option of error. Okay, so very, very easy to be used. In this case, as I told you, we choose injected composite for the aesthetical parts, and that's the finalization of our project in the upper, lower, and occlusal view of this project. In the master model, we check the fit of our final rehabilitation, and we check the easy way to remove using, in this case, the unlocking screw, but nowadays the unlocking instrument. So that's the final results in the upper jaw. The choice of the Seeger, as Gianni told you, the choice of the strengthness of the Seeger depends on different factors. So number of implant, position of the hole, divergence of the implant. You have to take together all those information to choose the correct position of the hole, because everywhere you will put your free hole for the unlocking instrument, it will work. But you have the option to choose it, taking care about aesthetical problem or a problem of space in the opening of the mouth of your patients. Another interesting thing is this sealing screw that give you the chance to seal the space of the equator dedicated to the screwing. So on those Seeger you won't use to the screw, you can seal with this sealing screw. And that's an interesting solution also when you use the equator for removable rehabilitation directly on the equator. So in this case, you use only the external retentive part of the equator. It doesn't matter about the screwed internal, the threaded internal part of the equator. You can seal with this dedicated screw to maintain more hygiene, okay, to avoid the problem related with those kind of hygiene. And that's the occlusal vision of the lower and upper jaw. All the equator are sealed by this screw. We leave free only two equator, one in the lower jaw and one in the upper jaw. And you can see in this transformation that in our final rehabilitation, we can preserve the integrity of the occlusal surface, just leaving the space for the unlocking screw. Okay, so something really similar to the cemented rehabilitation with the aesthetical benefit and the benefit related with the integrity of the occlusal surfaces. Okay, so that's the first case. It's a case of delayed loading and remaking of an old project, also realized on the OT Equator. So the benefit of using the OT Equator, with which you can change your treatment plane from removable to fixed, and in this case, all the benefit related with easy fix, so aesthetical and the integrity of the final solution. Okay, that's a video that shows the final results. So I think that fixed solution nowadays can be the good solution for Morena. Second case, it's a case of fixed rehabilitation in delayed loading. Why delayed loading? Because we went, first of all, in the study of this case, we got a problem in the upper jaw with a whole rehabilitation on natural teeth and with an impacted canine in the palate. So for that reason, we choose a prudent kind of surgery First of all, we remove the impacted canine and all the teeth, and we deliver to the patient a removable provision. On that way, we have the time to leave the bone heal, and of course, we have the time to study the answer of the patient to this new design of teeth, because we need something, we need some information to design our final project. So first of all, we deliver a removable rehabilitation. Now, we scan with an intraoral scanner, we scan our removable rehabilitation, and we can design the profile of a fixed one, because we can change the mistake, we can have better aesthetics, we can change a little bit the shape of the smile line. So starting from the provisional one, the removable provisional, we design a second fixed provisional. But why I told you about delayed loading? Because the easy fix will be realized for the final rehabilitation. And in this case, we realized a second provisional in immediate loading with the consolidated way of the OT bridge. So, same way of the last case, we go in mouth with a printed aesthetic test to be sure about the aesthetics. And we take all the information, the one related with the shape of the teeth and the other related with the available bone, to design our surgery. Because in this case, we work with computer-guided surgery. And first of all, we have to go with the digital project. We check the available bone, we check the position of the teeth, and we can choose direction of our implant in relation with the shape of our teeth. And that's very, very important in those solutions in which you need the screw, because the position in which your screw will go out from the prosthesis can give you mistake in the aesthetic. So in this case, the provisional will be OT bridge, classical solution, so with the hole for the screw, and we check the position of our implant, taking care about this problem. After the project, we design the surgical guide, and in lab, they design the provisional. So we can go the day of the surgery with all the instrument to deliver to the patient our provisional at the same time of the surgery. The surgery is a computer-guided surgery, so it's a little bit boring. We go fast. We go until the time in which we will put our equator. So after the implant, we screw the equator. We have chosen the height of our equator during the project, because with the dedicated program, you can check the thickness of the tissue. So in the day of the surgery, you arrived with the correct height of your equator. That depends on the kind of project. You can stay inside of the tissue or you can stay outside of the tissue, but the important thing is you can choose it first, respect the surgery. The way we bond the OT bridge is that, so fixing the extra grade abutment and leaving free all the hole in our provisional. It's very important, because in the next case, when we will work in easy fix, you will see how it is easier. Because here we have to manage 5 implant, 5 hole, and of course, it needs more time and a little bit more attention. But that's something that works very, very well. So that's our provisional delivered in OT bridge way, as usual, OT bridge way. Now, we just wait for the healing, for the osseointegration, the healing of our implant. And after something like 3 months, we are ready for the final rehabilitation. In this case, the final rehabilitation will be realized with the easy fix techniques. So something really similar, the things you have seen in the first clinical case, so the intraoral scan of the position of the implant, the scan of the provisional, and the catching of all the information to realize our new project, changing maybe the length of the teeth, changing the smile line. So all the correction you want to make respect the first provision. And that's the project of the new rehabilitation. As you can see, the height of the abutment is different respect the height of the abutment you've seen in the provisional, because here we are working with the mathematics of the easy fix abutment. So different respect the first clinical case in which we have scanned the physical abutment. Here we work with the mathematics of the easy fix abutment. As usual, the printing of an aesthetic test to be sure about the agree of the patient, and a plaster control key that in this case will be so useful because we can correct a little mistake in the impression. As you can see, plaster control key give you the chance to measure the perfect precision of your intraoral scan, or to change if, like in this case, you have little mistake. That's the printed aesthetic test in mouth. So now we got all the information. We are happy because we got all the information about the correct position of the implant and about the final design. That's the project. You can see different shape of the metal structure because in this case we have choose different aesthetic material. In this case, we've got printed composite, so we need different design of the metal parts. As you can see, we need more thickness for the aesthetical part. We don't need retention pin like in the case of injection composite. So those considerations are just because you have to understand that you can choose the kind of material you prefer. It doesn't change nothing. You will work with easy fix, the same way you work with OT bridge, same way you work on multi-unit abutment. If you want to work with zirconia, you can do that with metal ceramics, injected composite, printed composite, like in this case. It doesn't change nothing. Okay, so you just project your solution the way you prefer, and be sure that it will work the same way with this easy fix solution. Here you can see in the model the final prosthesis how work with the unlocking tool. So different respect the first case in which we have the unlocking screw, but and don't be confused. You just have to take care about the unlocking tool that is available today and work the same way you have seen before. So screw it on the hole, give you the chance to remove easily your rehabilitation. As I showed you before, the sealing screw to protect all the implant not involved in the using of the unlocking tool. And that's the final result, so aesthetical result with just only one screw and the maintaining of the integrity of the occlusal surface. So of course, better aesthetical result and more strongness of the complex of your rehabilitation. Okay. That's the starting situation, radiographic starting situation. That's the final radiographic situation. Last case maybe is the more interesting because here we work in immediate loading directly with the easy fix. So we can combine the benefit of the easy fix related with the absence of screw, so aesthetical, strongness, and all we have told until now, with the benefit of an easy way to bond your provisional after the surgery. So you will see the difference between the using of OT bridge, classical OT bridge or classical multi-unit abutment, with the using of the easy fix in the delivery of an immediate loading immediately after surgery. This case is interesting because 6 years ago, I worked on the lower jaw, just putting a provisional in the upper jaw. So the situation was a provisional and a whole denture in the lower jaw. we design a new provisional in the upper jaw just to change the line and just to deliver to our patient a correct rehabilitation in the lower jaw. So 6 years ago, OT bridge in the lower jaw and long time provisional upper long survival provisional in the upper jaw. That's 6 years ago. Now the patient want to go with the fixed final rehabilitation on implant also in the upper jaw. And the interesting thing is that starting from this situation, so our provisional that after 6 years is in good condition. Of course, we got problem with the remaining natural teeth, but the shape of the provisional is the same of 6 years ago. So what we have done, we take an impression, a scan, an intraoral scan of the provisional and of the mouth without the provisional to have all the information to design our surgery. So soft tissue, position of the root, final design of the provisional. And the interesting thing was that the comparison between the provisional today and the project of the provisional 6 years ago was at least perfect. So it changed nothing during the using of these 6 years. So, of course, it was a good job done 6 years ago, but it's an interesting thing because we can use the same information that we have preserved in those 6 years. Okay. So, as you saw in the last case, we take all this information together, the one related with the shape of the teeth, so STL file, and the one related with the available bone, so DICOM file. We put together all those information in the Real Guide program, and on that way, we can design our surgery. We can choose the position, length, diameter, and direction of our implant. We are lucky because we can put just one implant in post-extractive way, and we can preserve the other natural teeth. For that reason, we can design a surgical guide stabilized not only by the soft tissue, but also by the remaining natural teeth. And for the one of you that use those kind of surgery, it's clear the benefit to realize a surgery with a guide that can be stabilized by natural teeth and not only by soft tissue. So that's the project of our implant. In the project, we can evaluate the thickness of the soft tissue. And on that way, we can choose the correct eye of the prosthetic components. Because here, we have to choose our OT Equator abutment to move the connection from the implant to outside the soft tissue, and the dimension of our Easy Fix abutment that are available in 2 different dimensions. So on that way, our technician can project the rehabilitation, taking care about not only the position of the implant, but also taking care about the profile of the soft tissue, choosing the correct prosthetic components. That's the project of the rehabilitation. We have to preserve some tolerance because, of course, we will bond our provisional in mouth, and we are pretty sure about the position of the implant, but we have to preserve a little bit of confidence, designing a tolerance all around the attended position of our implant. So that's the design of our surgery guide, of our silicone index to put in the correct position our surgery guide, and that's the design of our provisional with metal structure of reinforcing and aesthetical parts. In this picture, you can see all the components you need to work with Easy Fix. So the unlocking tool, the correct seeger, the easy fix abutment, and the screw. That's all you need, one screw, that's all you need to work with easy fix solution. So the day of the surgery, of course, we put our implant. As usual, it's a computer-guided surgery, so a little bit boring. We go fast until the end, in the moment in which we put our. But the very interesting things is the prosthetical time. Because here in this video, you can see how easy is work with the EasyFix solution. Because we will screw just one abutment. All the other abutment are positioned by pressure, as you can see. And we don't have to leave free the channel of the screw, because it doesn't matter. We can leave free just one channel, the one we have choose to use the unlocking screw. So in this case, the number 1.4, I think, something like that. All the other abutment are not leave free. And for that reason, it's very, very fast and very, very easy. First of all, you check the passivity of the provisional. You must be sure that there's no collision between the abutment and the dedicated space inside the provisional. So you can do that with a fit checker, and you can correct little mistake. When you are sure about the passivity, you can bond it in mouth, and as you can see, waiting for the curing of the material. Now you have to leave free just one hole, not five implant, but just one. And using the unlocking tool, easily remove the provisional. Okay, so saving a lot of time, saving a lot of mistake related with the creation of the hole. In a few minutes, you can bond your provisional to the easy fix abutment in an easy way, easy and fast way. Okay, after the polishing, you can deliver the provisional. So that's the final results, starting from the left image to the right image, and that's the final results in mouth. So that's the immediate loading delivery. In this case, I think the interesting things is not only the benefit related with the easy fix concept, as I repeat, absence of cements, absence of the screw, aesthetic, integrity of the occlusal surfaces, but you can appreciate how easy and how fast it is to fix your provisional after the surgery in immediate loading. Okay? Okay, so those was the clinical case we have chosen for you to share our clinical vision. And Gianni, if there's some question, we are here to answer that.
Thank you, Emiliano. You can find also, we are here to reply to your question. You will find all the information also in our website. You can go, you visit, there are leaflets, step-by-step procedure. We are working on a 3D video to train you also in the detail of the functionality of the system. So really we are looking forward. We have, for anyone have any technical question, you can contact me in the website, gianni.storni@rhein83.com. So it's all over any catalog in our website. So please contact us for any info. Also, we will do program, courses, and training to explain in the details. To who want to go deeper in the system, we will also record webinars, even this one, into our website, so it will be available pretty soon. So we are really looking forward to be in touch with you. Okay, so I can say that if there is no question, we can close the connection, and we would like to thank you all. We were 140 in the room, so super
Thank you very much.
happy about that. Thank you very much for your attention, and looking forward to be in touch with you. Okay, so
Thank you
thank
very
you
much.
very much, and keep in touch. Thank you, Dr.
Thanks.
Ferrari.